The alarm hit at 23:47. Not the slow kind, not the steady pulse that gave staff time to breathe, stretch, and roll their shoulders before walking toward whatever came through the doors. This one detonated through the fluorescent corridors of Camp Lejeune's military treatment facility like a physical force, flattening every other sound in the building into silence before replacing it with something worse. Urgency without information, motion without direction, the particular chaos that arrives before anyone knows how bad it actually is. Three military transport vehicles swung hard into the receiving bay, tires screaming against wet asphalt. The rear panels dropped before the engines finished cutting. And then the night air carried something in with it, the smell of it reaching the corridor before anyone saw anything. Burnt metal, scorched fabric, the chemical signature of an IED detonation that no amount of training ever fully prepares a person to encounter outside of a classroom. 12 men on stretchers, some conscious, some not, all of them in tactical gear that had been designed to absorb punishment and had clearly been tested beyond its limits tonight. Ivory was standing with her back against the hallway wall when they came through. She had been there for 4 minutes before the alarm, not because she was late to anything, but because the supply closet near Bay 3 had been reorganized by someone who'd alphabetized gauze before trauma kits, and locating the correct chest seals had taken longer than it should have. The bother had not shown on her face. Nothing showed on her face, which was something people in the building had started to notice in small ways, without being able to articulate why it unsettled them. She was small. That was the first thing most people registered. Small frame, slight shoulders, the kind of build that made the scrub top look borrowed, and the trainee badge looked like something issued to a child on a school field trip. Her hair was pulled back with no particular effort. Her shoes were the ones the hospital issued to every new staff member, still uniformly white in a way that announced their newness to anyone paying attention. She carried nothing that distinguished her from the 17 other nurses who had rushed into position the moment the transport vehicles appeared, except that she was not rushing. She was watching. Her eyes moved across the incoming stretchers the way a carpenter moves a hand across wood before cutting. Methodical, unhurried, covering every surface with a precision that bore no relationship to haste. In the time it took the other nurses to register the number of casualties and reach for clipboards, Ivory had already cataloged what she needed. Chest wound on the 3rd stretcher, the kind of collapse pattern that indicated a tension pneumothorax developing not from the initial injury, but from the pressure change during transport. The tourniquet on the man in bay position 7 applied at the wrong angle, effective enough to slow the bleeding, but positioned in a way that was going to create a secondary problem within 15 minutes. The particular stillness of the man on stretcher 11, that meant unconscious, not sleeping, a distinction that mattered for triage sequence. 9 seconds. She had read all 12 in 9 seconds. Patient 3 needs a chest seal immediately, she said. Her voice was not loud. It didn't need to be. She had placed herself directly beside the nurse, pushing the 3rd stretcher, close enough that the words landed exactly where she intended them. Not standard gauze. The wound track suggests blast compression. Standard packing will occlude the wrong layer. You need to stop talking. Colonel Cassian did not look at her when he said it. He was pulling on surgical gloves as he moved from the operating corridor into the receiving bay, his focus already sorting the 12 incoming patients into the hierarchy that would determine who got his attention first. He was a tall man with the kind of posture that announced rank before anyone read his insignia. Shoulders set like load-bearing walls, jaw fixed in the permanent expression of someone accustomed to being the final word in any room he entered. The blood on his gloves from the previous case had not fully dried. He had not taken the time to change them. He noticed Ivory the way a person notices a chair left in the wrong position. Not with anger, not with interest, only with the brief, dismissive recognition of an obstacle that needed to be relocated. Trainee nurses are not authorized to conduct casualty assessment during a mass casualty event. He said it the way one reads from a policy document, without inflection, without acknowledgement that there was another person involved in the exchange. Return to the hallway. Now. Ivory did not argue. She did not explain. She did not look at him. What she did do, and it was subtle enough that only someone positioned directly behind her would have caught it, was look past his shoulder at the 3rd stretcher, at the man on it, whose breathing had begun to shift from labored to the specific shallow rhythm she had heard in one other crisis. She slowed slightly when she passed Ivory. "Sorry about that," she said, quietly enough that the apology was clearly not intended for anyone else to hear. "Colonel Cassian runs a tight ship," Ivory nodded. Said nothing. Daisy hesitated for half a step, then kept moving. From the receiving bay, a voice rose above the organized chaos. Erica, the senior nursing coordinator, navigating between stretchers with the kind of authority that came from a decade in emergency military medicine. She was good at her job. She knew she was good at her job, and she moved through the bay with the particular efficiency of someone who had long since stopped questioning whether she belonged there. When she passed the hallway junction and noticed Ivory still standing with her back to the wall, she did not slow down. "Trainee hasn't been cleared for mass casualty protocol," she said, addressing no one specific, or perhaps addressing the concept of the trainee as a category rather than Ivory as a person. "That's policy, not preference. The hallway is exactly where she should be." Ivory's gaze moved to the bay window, the long rectangular panel of reinforced glass that separated the receiving area from the corridor. Through it, she could see everything: the stretchers in their positions, the staff moving between them, the man on stretcher 3, whose breathing she could not hear from here, but whose chest she could watch rising and falling in the pattern she had already identified. Her right hand, resting on her knee, began to tap, a quiet rhythm against her own leg. Anyone watching would have assumed it was nerves, the habitual fidgeting of someone waiting anxiously in a hallway. But the intervals were precise, not random. Each tap timed to the visual cues she was reading through the glass. Pulse rate estimated by observation, oxygen saturation approximated by skin tone under fluorescent light, blood pressure trend inferred from the behavior of the wound. She was counting vital signs by eye. She had been doing it for 9 years. Heather, the head nurse, passed the hallway junction at a controlled pace, the walk of someone managing 3 simultaneous priorities without letting any of them show on her face. She was in her 50s, with the kind of competence that had stopped needing to announce itself somewhere around year 15 of a career that had taken her from base hospitals to field units and back again. She paused at the supply corridor, made a mental calculation, then turned to look at Ivory. "I can use you on vital signs, monitoring for the stabilized patients in Bay 4, she said. Her voice had none of Cassian's dismissal in it, and none of Erica's pointed correctness. It was simply practical. "That's within your authorized scope. Follow me." Ivory stood up and followed her. The stabilized patients were the ones who had been assessed as lower immediate priority, wounds serious enough to require monitoring, not serious enough to compete for the first wave of surgical attention. Bay 4 held 3 men, all conscious, all watching the ceiling with the particular expression of people who had survived something and not yet begun to process what that meant. Ivory moved between them. She checked each pulse at exactly the correct anatomical position, not the approximate placement that most nursing students learned in their first semester, but the precise location that reduced measurement error to within 2 beats per minute. Her fingers moved without searching. The documentation she produced used the SOAP note structure: subjective, objective, assessment, plan, in a format that was standard in tactical combat casualty care but was not what this hospital's civilian-adjacent intake forms called for. Daisy, passing behind her to retrieve something from the supply cabinet, glanced at the paperwork and stopped. "That's a different format," she said, not accusingly, more the way someone notes that a familiar road has changed direction. "It's more efficient for multi-casualty intake." Ivory did not look up. "Where did you learn it?" A pause, precise enough to be measured. "Online resources." Daisy looked at her for a moment longer than the exchange warranted, then went back to what she was doing. At stretcher 5, Ivory noted the tourniquet issue she had identified from the hallway. The angle was wrong, functional, but creating vascular compression at a secondary point. She reached for it while writing the intake notes, a simultaneous motion, and adjusted it by approximately 2 centimeters before withdrawing her hand and continuing to write. The man on the stretcher exhaled, not loudly, but the particular release of a body registering the cessation of a pain it had been managing. He stopped making the small, involuntary sound he'd been producing since they'd wheeled him in. Heather, near the door, turned at the sound of silence. She looked at the man on stretcher 5. She looked at Ivory. She did not say anything. But she did not look away immediately, and something in the calculation behind her eyes shifted fractionally. It was Erica who noticed next, and Erica's response was the opposite of Heather's. She crossed the bay in 8 steps, her voice pitched low but carrying clearly through the space. "You are not authorized to modify a tourniquet application without direct physician supervision. That is not within your current scope. Do you understand what I'm telling you?" "Yes, ma'am." "Then I need you to step back from the patient." Ivory stepped back from the patient. Behind Erica, Daisy looked at the man on stretcher 5, the one who had stopped making that sound. She looked at the tourniquet. She looked at Ivory's retreating posture. Her mouth pressed into a thin line, and she turned back to her work with the expression of someone filing something away. Hit subscribe and turn on notifications, because what happens in the next 30 minutes will completely redefine everything you thought you knew about this rookie nurse. If you've ever been dismissed by someone who had no idea who they were dealing with, you know exactly how this feels. Don't go anywhere. From the far end of the bay, a man's voice spoke quietly. "Who is that?" Fletcher was one of the conscious patients in Bay 4. Wounds to his left shoulder and right forearm, neither life-threatening, both painful. He had been watching since Ivory entered the bay. Not the casual observation of a bored patient, but the specific quality of attention that belongs to someone cataloging information against a known pattern. He was in his late 30s, with the build of someone who had spent a decade and a half doing things that required it, and the stillness around his eyes that comes from having been in places where drawing attention could end you. He was watching Ivory's hands. "She's the trainee nurse," Hugo told him, not unkindly. Hugo was the anesthesiologist covering the bay. Compact, precise, the kind of doctor who got along with everyone because he had learned that certainty and humility were not mutually exclusive. He was adjusting IV flow rates with the focus of a man who trusted very little to chance. "Assigned 3 weeks ago." "Why?" Fletcher didn't answer. He kept watching. At the receiving bay, Raymond had arrived with his administrative clipboard, the physical manifestation of a system that needed every crisis to generate its own paperwork in real time. He was not a medical professional. He managed personnel compliance, credentialing, and the institutional machinery that kept a military hospital functioning as an institution rather than simply as a building where injured people received care. He was good at his job in a way that was sometimes helpful and sometimes not. Cassian directed his attention toward the Bay 4 junction with a gesture that required no words. Raymond followed it, looked at Ivory, and began writing. Ivory, who had resumed her vital signs documentation from a position that respected the boundary Erica had established, did not look at Raymond. She continued writing. Her handwriting was even and legible, and produced at a pace that suggested she was thinking faster than her hand was moving. The trouble with watching someone be dismissed repeatedly in a single hour is that at some point the watching begins to accumulate into something heavier than discomfort. Daisy was feeling it. She stopped near Ivory while collecting intake forms and kept her voice below the ambient noise level of the bay. "You knew about that tourniquet before you looked at it. How?" Ivory wrote 2 more words on the intake form before responding. "Positioning. The angle of the original application created a secondary compression point. It was visible in the hallway." "Through the window?" "Yes." Daisy stared at her. "From 40 feet away. Closer to 35. Daisy did not have a response for this. She left with her forms. The crisis point came from stretcher 8, a patient who had been assessed as stable and who demonstrated, in the abrupt and uncompromising way that bodies sometimes make liars of assessments, that he was not. The seizure began with the particular suddenness that leaves no preparation time. One moment a patient lying quietly, the next a cascade of involuntary movement that required immediate physical intervention. 2 nurses were in the bay. Both were occupied with other patients. There was a half-second gap, the kind that in a well-staffed facility with no other simultaneous emergencies would have been filled before it became consequential, but that in a mass casualty response at 47 minutes past midnight existed as a genuine interval of danger. Ivory covered the distance in 3 strides. Her hands found the correct positions. Head stabilization, lateral support, nothing that would increase injury risk. Before either of the other nurses had fully processed what was happening. Her voice was even. 15 seconds. Don't restrain. Let the sequence complete. She was counting out loud, a steady verbal anchor for the room. Don't attempt to open the airway until the tonic phase ends. The seizure ran its course. The patient stilled. His breathing resumed. The particular alarm that a seizing patient generates in a room full of people, the held breath, the frozen motion, began to release. Ivory was already withdrawing to her previous position before anyone thought to thank her or question her, but she had been visible, fully, unambiguously visible, in a way that the tourniquet adjustment and the documentation format and the chest seal suggestion had not been. Those things could be rationalized, questioned, attributed to luck or to textbooks or to the false confidence of inexperience. This one was different. The economy of the motion, the knowledge implicit in where she placed her hands, the specific clinical language delivered without hesitation or reference. These things were not consistent with a person who had learned medicine 3 years ago in a classroom. The bay held a silence that was not quite silence, the kind produced when people are processing information that doesn't fit the categories they've been using. Cassian broke it. "Where did you learn that?" He was standing at the bay entrance. The statement was not a question in any practical sense. The flat delivery, the lack of rising inflection, communicated that he was not interested in an answer so much as he was interested in establishing that the question had been asked. "Continuing education materials." Ivory's voice was steady. "Sir, continuing education materials." He repeated it with the precise intonation of someone reading back a claim before rejecting it. "For trainee nurses who are not authorized to manage acute neurological events without physician supervision." He stepped into the bay. "I'm going to say this once more, and I would like you to hear it clearly. You are here to observe, to document, and to follow the directions of the senior clinical staff. You are not here to treat patients. You are not here to demonstrate skills that you have not been credentialed to use in this facility. And you are not here to give me or anyone else cause to question whether this department's protocols are being followed." He held the silence for a moment. "Is that understood?" "Yes, sir." "Good." He turned to Erica. "Find her something to do that doesn't involve patient contact." Erica assigned Ivory to inventory documentation in the supply corridor. It was, as punishments in a medical setting went, thorough. The supply corridor was separated from the bay by a solid wall. No window, no line of sight to any of the 12 patients. The work was exactly as described. Counting, listing, organizing the detritus of a mass casualty response that was consuming materials faster than they could be tracked. Ivory did it without complaint. She moved through the shelving with efficiency, her pen moving in the ledger columns, her lips not quite forming the counts she was keeping in her head. From here she could hear voices, fragmented through 2 sets of walls, but not the specific clinical exchanges that would tell her what was happening in the bay. She worked for 11 minutes before Heather appeared in the corridor entrance. The head nurse closed the door behind her, not loudly, but with the deliberate click of someone ensuring privacy. She looked at Ivory for a moment with an expression that had shed its professional neutrality, bitsimamab, leaving something more considered in its place. "If there's something you need to tell me," Heather said, "this is probably the moment." Ivory looked at her. The look lasted long enough to be a full assessment, the kind that takes in not just what someone says, but what they're willing to do with what they hear. Heather's record showed 31 years of military nursing, 2 combat rotations, and a professional discretion that had earned her the respect of people who did not give it easily. Ivory had read her file on the second day from the personnel terminal in the administrative office during the 4-minute window when the terminal's user had stepped away for coffee. "No," Ivory said. "Thank you." Heather's exhale was quiet and precise. She nodded once, the nod of someone who had expected this answer and had a plan for it regardless. "I'll need you back in Bay 4 in 10 minutes. Hugo's running short-handed." She left. The door clicked behind her. And in the supply corridor, for the first and only time since the night had begun, Ivory stood still. Not the parade rest stillness of the hallway, not the focused stillness of a person monitoring patients, but the particular stillness of someone carrying something very heavy and choosing, again, to keep carrying it. Her right arm hung at her side. The sleeve of the scrub top covered it completely. She went back to counting supplies. The situation at Stretcher 7 had been deteriorating with the patient consistency of a problem that was being managed rather than solved. Ronan, the man on Stretcher 7, the most critically injured of the 12, had arrived with the kind of wound profile that represented a genuine diagnostic challenge. Multiple blast trauma indicators that could point towards several different primary injury sources, with treatment implications that diverged significantly depending on which interpretation was correct. Floyd had assessed it as splenic. Cassian had agreed, conditionally. Hugo had not agreed, but Hugo was not the attending surgeon on this case, and his role in the decision tree was limited to the anesthetic considerations that would follow whatever surgical intervention the attendings chose. The disagreement had been running for 22 minutes. Ronan's blood pressure had dropped twice in that window. In Bay 4, through the wall, Ivory could not see any of this. But she had been in the bay with Ronan for 4 minutes during the initial vital signs round, and she had stood at his stretcher with her pen over the intake form and her fingers not quite touching the casing, and she had done what she did with all of them, read what the body was saying in the language that it used when words weren't available. When Hugo came to the supply corridor entrance, not summoned, not sent, moving under his own initiative, he found her replacing the last items on the inventory list with the steady pace of someone finishing exactly what they'd started. "Can I ask you something off the record?" His voice had the slightly effortful casualness of a man stepping outside a professional framework he normally operated comfortably within. Ivory capped her pen. "Yes. Patient 7, your assessment." A beat, not hesitation. More like a person deciding how much of a foundation to build before placing weight on it. "Right hepatic artery branch," she said. "Not splenic." Hugo went very still. "The guarding pattern," Ivory continued, her voice carrying the particular neutrality of clinical communication. No investment, no persuasion, just information. "Right upper quadrant response not diffuse. Periumbilical skin color change, consistent with retroperitoneal hematoma. The muscle reflex behavior is organized around the right lobe, not the hilum." She paused. "If the intervention targets the spleen, the primary source will continue unchecked." Hugo looked at her the way a person looks at a map that has just shown them they've been traveling in the wrong direction. "You diagnosed that without imaging. The imaging isn't wrong. The interpretation of it is." "How?" Floyd's voice cut across the bay from behind Hugo. "What's going on over here?" He had not intended to come to the supply corridor. He had come because the conversation between Hugo and the trainee nurse had exceeded 45 seconds, and that duration, in a mass casualty response, meant something was wrong with someone's priorities. He was a compact man with the slightly forward lean of someone accustomed to being the most technically prepared person in a room, and the expression on his face as he processed the exchange he'd interrupted was the expression of someone who had just found a variable they hadn't accounted for. "She was suggesting an alternative assessment for patient 7, Hugo said. Floyd's expression did not change in any dramatic way. It just became more specific. "She was." He looked at Ivory. "Without imaging confirmation, without attending authorization, without apparently any clinical credentialing that would permit her to—" "The hepatic artery branch," Ivory said. She was looking at Floyd steadily, with the particular quality of attention that belonged to someone who was not trying to win an argument but was trying to keep a patient alive, and who had accepted that these two things might require different approaches. "Right lobe." Reboa would address the source without the risks of open thoracic intervention at his current pressure levels. The word Reboa landed in the corridor the way an unexpected object lands on a quiet surface, not explosively, but with a resonance that changed the acoustic quality of the space. Resuscitative endovascular balloon occlusion of the aorta was not a procedure that appeared in standard nursing training curricula. It was not something that came from continuing education materials for trainee staff. It was a field intervention technique developed from combat casualty protocols, used in environments where conventional surgical approaches were not available or not survivable, requiring a level of anatomical knowledge and clinical experience that was measured in years and operational deployments rather than textbook hours. Floyd stared at her. "She's a trainee," he said finally, addressing Hugo rather than Ivory, as if the fact needed to be restated before he could proceed. "She has been assigned to this facility for 3 weeks. She is not credentialed for clinical assessment, she is not authorized to recommend surgical interventions, and I am not having this conversation." He turned and went back into the bay. Hugo remained. He looked at Ivory for a moment longer, the look of a man who had understood something and was deciding what to do with it. "If you're wrong," he said quietly, "the conversation this morning is just noise. If you're right, I'm not wrong." He held her gaze for 3 seconds. Then he went back in. Raymond returned to the hallway with his clipboard and the specific energy of someone who had made a phone call and received information that had adjusted his understanding of the situation without fully resolving it. He approached Heather, who was moving between bays with 3 tasks in her hands. Personnel file for the trainee nurse, he said. Level restriction on the database access. I can't get past the initial clearance layer. Heather, without slowing, escalate it through your supervisor. I did. He's escalating further. Raymond looked across the bay toward the supply corridor. Someone locked her file above standard personnel clearance. That's unusual for a trainee nurse. Heather's tone communicated nothing specific. Does that mean something to you? Heather stopped, turned, looked at Raymond with the expression of a woman who had been in military hospitals long enough to understand that some questions produced better outcomes when they were not asked. It means it's above both our pay grades, Raymond. Finish your intake forms. Raymond looked at his clipboard. He did not finish his intake forms. The shift in momentum came from Stretcher 3, which was in a way where it had always been going to come from. Floyd had been managing that patient since the beginning. The chest seal that Ivory had specified had found its way to the bay through Daisy, who had retrieved it from the supply station without explaining why she was taking a non-standard item, and it had been used, Floyd had used it, without comment or acknowledgement, because the patient had needed it. The patient on Stretcher 3 was breathing correctly now. Floyd knew it. He was not going to say anything about it. What he couldn't ignore was the moment when Stretcher 3's patient required needle decompression, and there was no one immediately available to perform it. Erica was occupied. The other nurses were occupied. Hugo was managing anesthesia for a patient being prepped for the procedure that was still being debated. The patient on Stretcher 3 had approximately 90 seconds before the pressure differential became irreversible. Ivory was standing 4 feet away. She held out the needle. Mid-clavicular line, she said. Second intercostal space. The angle was precise. The location was exact. She did not say it with confidence as a performance. She said it the way someone gives a street address they've known for years. Floyd took the needle. He performed the procedure. The patient stabilized. Floyd stood with the needle still in his hand and looked at Ivory with an expression that was no longer simply dismissal. It had become something more complex, the specific discomfort of a technically skilled person who has just received accurate clinical guidance from someone who, by every available metric, should not have been able to provide it. "Where do you know that from?" he said. "Reference materials, sir." The pause that followed had a particular texture. "Right," Floyd said, and he turned away, and he walked to the far side of the bay, and he stood there for a moment with his back to the room before he went back to work. Every doctor in that room just watched a trainee nurse do what none of them could. They're calling it luck. They're calling it coincidence. They're calling it anything except what it actually is. But patient Ronan just opened his eyes, and the look on his face says he knows exactly who she is. Subscribe now and share this video, because the truth about Ivory is 30 seconds away from destroying everything in that room. At the supply station near the corridor junction, Daisy had stopped pretending to count items. She was looking at Ivory across the bay with the expression of someone who had been adding numbers and had arrived at a sum that didn't match any number she'd expected. The sleeve of Ivory's scrub top had moved slightly when she'd handed the needle to Floyd. Not much, not enough to reveal anything, but enough for Daisy, who had been positioned at the correct angle and who had been paying attention in a way she couldn't entirely account for, to see the edge of something on Ivory's forearm. Not a bruise, not a burn from cooking or a scar from a childhood accident. The shape was wrong for those things. The distribution was wrong, the kind of marking that came from proximity to a specific kind of event, and that didn't appear in civilian medical histories at any frequency worth measuring. Daisy looked away. She felt something cold move through her that was not fear, exactly, but was adjacent to it. She went back to counting. But her hands were not quite steady. The situation with Ronan came to its crisis point at the 2-hour mark. The monitor registered the blood pressure drop with the alarm's characteristic urgency. Hugo's voice cut across the bay, "We're losing him," and the specific galvanic response of a room full of medical professionals recognizing an immediate threat moved every available body towards Stretcher 7 simultaneously. Except that simultaneous motion in a 12-patient mass casualty scenario was not the same as useful motion. Cassian and Floyd converged on the stretcher and began the process of arguing their way toward a decision, which was not the same as making one. The splenic interpretation versus the hepatic interpretation. Two experienced surgeons, both with legitimate technical credentials, both with their professional identities invested in their respective positions, burning seconds they didn't have. Ivory walked through the bay entrance. She did not run. She did not ask permission. She moved at a pace that conveyed purpose without panic, crossed the distance to Stretcher 7, and placed her hand on the right upper quadrant of the patient's abdomen, precisely, without searching, with the tactile certainty of someone who had felt this specific pattern of muscle response before. "Here," she said, "not splenic, reboa. Now, not thoracic." She looked at Hugo. "Can you maintain MAP above 65 without open intervention if I control the hemorrhage source?" The room had gone very quiet, in the particular way that rooms go quiet when something has shifted that cannot be shifted back. Hugo looked at the monitor. He looked at Cassian. He looked at Floyd. He looked at Ivory's hand on the patient's abdomen, placed with the certainty of someone who had performed this assessment not in a simulation, but in a field where the consequences of imprecision were measured in lives. "Tell me the placement," Hugo said. His voice had abandoned its previous register entirely. This was the voice of a clinician gathering information he was planning to use. Ivory told him. "Aortic balloon catheter. 7th French. Zone 3 placement based on anatomical landmarks." She described the pressure gradients, the expected hemodynamic response, the timing sequence for balloon inflation that would give the surgical approach its necessary window. She did not consult anything. She did not hesitate. The information came out of her with the kind of fluency that belongs to things that have been done, not just studied, the knowledge that lives in hands and muscle memory, and the specific neurological pathways carved out by repetition under pressure. Floyd said, "She cannot recommend surgical intervention. She is a trainee nurse. I don't care what she thinks she knows." Hugo looked at the monitor. The number was dropping. He looked at Floyd. He looked at Ivory. He said, "Walk me through it step by step," and Ivory did. What happened in the following minutes was not dramatic in the way that dramatic things are usually portrayed, with sound and light and the clarifying resolution of a problem that has been building toward its solution. It was quiet, intensely, almost unbearably quiet, in the way that genuine crises often are when the people managing them know what they're doing. Hugo working, Ivory guiding with the specificity of someone who had performed this blind, in the field, without fluoroscopy, with conditions that made this sterile bay with its functioning equipment and adequate lighting look like luxury. Cassian standing at the edge of the action with the specific stillness of a man who had lost the thread of his own authority and did not yet know what to do about that. The monitor's alarm stopped. Ronan's blood pressure stabilized. The room held the particular silence of the aftermath of a prevented disaster. Not celebration, not relief, but the stripped-down quiet of people who have just been in the presence of something that changed their understanding of several things simultaneously. Hugo exhaled slowly. He looked at Ivory with the expression of someone doing a rapid reassessment of a significant number of previous conclusions. "You've done this before," he said. It was not a question. "The balloon catheter technique?" Ivory stripped the gloves methodically, the same economy of motion she brought to everything. "Once, without fluoroscopy." She paused, and a faster timeline. Cassian moved, not toward Ivory, toward Raymond, who was still holding his clipboard in the corridor entrance, with the expression of a man who had just watched a structural wall in his worldview develop a significant crack. "I want that file," Cassian said, his voice carrying the specific edge of someone accustomed to having access to information and encountering an obstruction for the first time. "Whatever clearance level it requires. Get through it." "Sir, the database—" "Get through it!" Raymond took out his phone. Ivory, across the bay, removed her gloves one finger at a time and did not look in their direction. Fletcher had been watching since she'd entered the bay. He was upright now, the wound in his shoulder allowing for a sitting position that he was maintaining with the carefully controlled expression of someone managing significant pain without letting it change their behavior. His eyes had not left Ivory since the moment she walked through the bay entrance, and now they held something that was not quite recognition. Or rather, it was recognition of a type, the preliminary registration of a pattern against a known template, the moment before confirmation that leaves you suspended in a particular state of disbelief and hope. He watched her hands. He watched the way she moved through the clinical space. He watched the angle of her head when she was listening, and the precise economy of her gestures when she was working, and the specific quality of her stillness when she was waiting. Something in his face had gone very still. At stretcher 7, the man who was not going to die tonight shifted. The movement was small, not voluntary in any purposeful way. The involuntary adjustment of a body responding to improved blood pressure and the particular sensation of returning consciousness. His head moved against the stretcher. His eyelids flickered, opened. Ronan looked at the ceiling for a moment. Then, with the deliberate effort of someone swimming up through significant distance, he turned his head. He moved his gaze across the bay in the slow sweep of a person searching for something specific. Not panicked, not confused, but purposeful in the way that trained people are purposeful even in the first moments of consciousness after crisis. His eyes crossed Hugo, crossed Cassian, crossed the monitors and the IV lines and the equipment, found Ivory, stopped. He looked at her for 3 seconds without any change in his expression. And then the thing that moved across his face was not surprise. Surprise would have been the wrong word entirely. It was something more like the expression of someone who has been carrying a weight they expected to carry forever, and has just been told, unexpectedly, that they can set it down. His lips moved. The sound was less than a whisper. From across the bay, from any reasonable distance, it was inaudible. But Daisy was near, and Daisy, who had been watching without fully understanding why she could not look away, was close enough to read the shape of the single word his lips formed. Ghost. She did not know what it meant. She felt the hair on her arms stand up in a way that she couldn't account for. She looked at Ivory. Ivory had gone very still in the way that still things go still when something has touched them that they had stopped expecting. Fletcher saw it. All of it. The word on Ronan's lips. Ivory's response, the quality of recognition that passed between them in the silence before anyone else in the room understood what they were witnessing. His right hand, which had been resting on the side rail of his stretcher, slowly formed a fist. His jaw was working. His eyes were bright with something that had nothing to do with the pain in his shoulder. And then Raymond's voice cut across everything with the particular quality of a man who has just received news that has moved his understanding of the situation into territory he was not prepared for. Colonel Cassian. He was looking at his phone. My supervisor's supervisor has informed me that the file access restriction is... He paused, as if the next word required more preparation than he'd anticipated. Classified, SCI compartmented. He's escalating to SOCOM liaison. Cassian turned slowly. His gaze moved from Raymond to Ivory, and then back to Raymond, with the measured deliberateness of someone constructing a new framework to understand a situation that their previous framework had failed to account for. SCI, he said, quietly. Yes, sir. The bay had gone quiet in a different way than the post-procedure quiet. That had been the quiet of aftermath. This was the quiet of anticipation, the specific stillness of a room holding its breath before a thing becomes irreversible. Bradley appeared at the bay entrance, summoned by a communication from Cassian that had bypassed the clinical chain of command entirely. He was military police, compact and procedural, the kind of person who operated best within clearly defined parameters and who was currently operating in a situation where the parameters were, it was becoming apparent, considerably less clear than they appeared. Non-authorized personnel in a restricted clinical area, Cassian said to Bradley with the precision of someone locking in the terminology before the situation could complicate it further. I need her removed. Bradley moved toward Ivory. Fletcher stood up. He did it the way people in physical pain stand up when they have decided that standing up is what the moment requires. Not gracefully, not without cost, but with the absolute commitment of someone for whom the alternative was worse. He was upright before Hugo could stop him, before anyone could fully register that the patient who had been told not to move for the past 2 hours was now standing, shoulder bandage and all, with the kind of posture that announced his right to occupy the space he was standing in as plainly as any insignia. Sergeant Bradley. His voice had changed completely. The controlled quietness of a patient was gone. What had replaced it was the voice of someone accustomed to being heard in conditions considerably louder and more dangerous than a hospital bay. Stop where you are. Bradley stopped. It was not a conscious decision. It was the involuntary response of a nervous system trained to respond to certain vocal qualities with certain behavioral outcomes, regardless of the context in which they appeared. Cassian turned to Fletcher with the expression of a man whose authority was being tested in a new direction. Petty officer, you are not medically cleared to... Look at her hands, Fletcher said. His voice was not angry. It was not loud. It had the particular quality of a statement that does not need volume or emotional investment, because the thing it is pointing toward will do the work on its own. No one immediately understood what he meant. Erica looked at Ivory's hands. Daisy looked. Floyd, from the far side of the bay, looked. Ivory's hands were completely, absolutely still. In a bay where 12 people had spent 2 hours in continuous controlled motion, where the aggregate of a mass casualty response was expressed in constant movement and sound and managed urgency, Ivory's hands rested at her sides with the particular quality of stillness that comes not from passivity, but from discipline. The stillness of someone who had learned, in conditions and contexts that no one in this room had yet fully understood, that stillness was sometimes the most powerful thing a person could be. Daisy felt it again, that cold thing that wasn't quite fear. She had learned to pay attention to that feeling. It had not, in 34 years of living, turned out to be nothing. Hugo looked at Ivory's hands, then at Ivory's face, then at Ronan, who was watching with the expression of a man who was witnessing a thing he'd long since stopped believing he would ever see. Then Heather's voice came from the doorway. "Colonel Cassian." Her tone carried the flat urgency of someone delivering information that was going to change the shape of the next several minutes, regardless of anyone's preferences. "Priority Communications Line, SOCOM. They're asking for authorization override on a personnel file in our system." She paused. "They said it's not a request." The room went still. Cassian looked at Heather, at the phone in her hand, at the words "so calm" on the screen. And then Heather did something that was technically outside her authority in approximately 4 different ways, and that she had clearly decided to do regardless. She crossed the bay, walked directly to Ivory, and placed the phone in her hand. Ivory looked at the screen for 1 second. She raised the phone to her ear. The bay held its breath. "This is General Kingsley." The voice from the line was audible to the 3 people closest to Ivory, Heather, Daisy, and Bradley, who had not moved since Fletcher had stopped him. "I'm looking for the sole surviving member of SEAL Team 9. What happened to Ivory's face in the moment between hearing that sentence and responding was not a dramatic thing. It was a small thing, something behind the eyes, something in the set of the jaw, the fractional adjustment of a person who has been carrying a particular weight for a very long time and has just felt the ground beneath them become solid again. She closed her eyes for the span of 1 full breath. When she opened them, her voice was quiet and even, and carried the absolute certainty of someone stating a fact that had always been true. SEAL Team 9. The room stopped, not figuratively, literally, the particular cessation of all incidental movement that a space full of human beings can achieve when something happens that reaches past their professional training and individual responses and touches something more fundamental. The monitor continued. The ventilators continued. But every person in that bay was, for the span of several seconds, entirely motionless. Bradley's hand, which had been in position to take Ivory's arm, fell to his side. Erica sat down. Not by choice. Her legs simply completed a motion that her body had decided upon without consulting her. Floyd stepped back a single step and then stopped, his expression having moved through several phases in rapid succession before arriving at something that had no professional category and was simply, plainly, human. Cassian was leaning against the wall behind him. He was not aware of when he'd moved there. Daisy was crying. She did not know when that had started either. And Fletcher, who had known, who had been watching and cataloging and arriving at an understanding that had moved through him like cold water since the moment she'd walked into the bay. Fletcher stood in his full height, his wounded shoulder and his damaged arm, and all of the cost of 2 hours upright notwithstanding, and came to attention. Not because anyone told him to, not because protocol required it. Because there are moments when the body understands, before the mind has finished processing, exactly what the correct response is. And that response requires no instruction. At the center of all of it, Ivory lowered the phone. She looked at Ronan, who was watching with the small curve at the corner of his mouth that was not a smile exactly, but was the expression of someone who has survived something specific enough to understand precisely what this moment cost. She looked at the bay. She looked at 12 men who were alive. She said to Hugo, without any particular emphasis, "Get the Reboa kit, 7 French catheter. I'll walk you through the procedure for patient 7 under proper supervision this time." A pause. "Then we're going to need to have a different conversation about the rest of them." Hugo was already moving. The Reboa kit arrived on a steel tray, and the sound it made when Hugo set it down was the thing that broke the stillness in the bay. Not loudly, not dramatically, just the small mechanical note of work resuming, which was in its way the most significant sound the room had produced in the last 2 minutes, because it meant the world was continuing, that the suspended moment had released its hold, and that the people inside it were going to have to decide what to do next. Hugo had made his decision. It was visible in the way he moved. The slightly altered center of gravity of a man who had shifted his operational reference point and was now navigating by a different set of coordinates than the ones he'd started the night with. He positioned himself at stretcher 7 with the focused efficiency of someone who had concluded that time spent on uncertainty was time the patient didn't have. Zone 3 placement, he said, addressing Ivory, not as a question but as a starting point. Zone 3, she confirmed. She moved to the opposing side of the stretcher, pulling fresh gloves from the dispenser with the practiced economy that had, over the course of 2 hours, accumulated into a pattern the entire bay had been unconsciously registering. Catheter entry at the common femoral, confirmed placement by the hemodynamic response before inflation. His pressure will tell you faster than imaging at this stage. Guidance on inflation pressure? Start conservative. His vascular tone is better than the numbers suggest. He's been compensating. She glanced at the monitor. For a while, Hugo worked. Ivory guided, not with the eager over-explanation of someone demonstrating knowledge, but with the spare, exact language of someone who had done this in conditions where every word cost something, and imprecision was not survivable. She told him what to look for. She told him when to wait and when to advance. She told him, at one specific juncture, to hold position for 8 seconds rather than 6, and he held it, and the hemodynamic response came exactly when she said it would. She said nothing about being right, because that was not the point. The point was that Ronan's blood pressure climbed, steadily, incrementally, with the particular quality of a number that intends to keep going in the same direction. Floyd was watching from the perimeter of the procedure. He had not resumed his work on the other patients. He was watching with the expression of a technically excellent physician confronting the specific humility of encountering someone better at a thing than he was. Not better in a theoretical sense, not better on paper, but better in the practical, embodied way that comes from having done it when it was real. He watched Ivory's hands. He watched where she looked, and when she spoke, and when she went silent. He watched the way she and Hugo moved around the procedure as a unit without having worked together a single minute prior to this night, falling into a clinical rhythm that required no coordination because the language they were both using, reading a body's response in real time and adjusting accordingly, was fluent enough in both of them to make translation automatic. When it was done, when the monitor showed a number that meant a man who had been dying was not dying anymore, Floyd did something that required more than it appeared to. He walked across the bay. He stopped in front of Ivory, who was removing her gloves for the second time in an hour, with the same methodical precision she'd used the first time, and he said, "The hepatic diagnosis was correct." "The Reboa guidance was correct." He paused. His jaw worked slightly. "I should have heard the argument earlier." Ivory looked at him. 2 seconds. Long enough to be an assessment, not long enough to be a judgment. "The next time a patient needs it," she said, "hear it sooner." It was not forgiveness exactly, and it was not rebuke exactly, and Floyd received it as the thing it was. The response of someone who measured the value of an apology not by its sincerity, but by whether it would change the next decision. He nodded once and went back to his station. Hugo, disposing of the procedural packaging, spoke without looking up. "Kandahar, August of 2021? He asked it quietly, the way someone asks about something they already know the answer to but need confirmed. Ivory's movement did not pause. 0600, August 12th, Sector 7. I read the operational summary that circulated on what was acknowledged. He looked up now. It described a field surgical intervention that shouldn't have been survivable, either for the operator performing it or for the patients. He stopped. The reports redacted the name of the team member who performed it. Reports usually do. Were the procedures similar to tonight? Ivory looked at Ronan's monitor. The numbers were holding. Tonight was easier, better light, better equipment, considerably less concurrent gunfire. Hugo was quiet for a moment. How many did you manage that day? 3 operators, different injuries, sequential. She paused, and what moved across her face was not the dramatic weight of trauma being narrated for effect, but the particular flatness of someone recounting events real enough to not require embellishment. Ronan was the first. The intervention held long enough for extraction. The other two... She stopped, brief. The other two didn't make extraction. Hugo received this with the silence it deserved. From stretcher 7, Ronan's voice came, rough and compressed by pain, but coherent in the specific way that coherence arrives when a body has been pulled back from the edge and is taking stock. She held the compression for 22 minutes. He was speaking to the room in the way that people speak when they need something to be heard. Improvised hemostatic agent from Field Kit. One-handed, because her other arm had been... He stopped, looked at Ivory. 30% function in the right hand for 6 weeks after. Ivory did not look at him. Your pressure is stable. Stop talking. Daisy had stopped pretending to sort the supply cart. She was standing near it with her intake forms long since abandoned. The other two, she said, barely audible. Fletcher said the team didn't know you'd survived. Extraction was complicated. Ivory's voice was even. I was listed as missing in action for 4 months. By the time command confirmed status, the unit had completed stand-down. She picked up the chart for stretcher 7 and began updating it. It seemed cleaner to let the administrative correction happen quietly. Fletcher from across the bay. It wasn't cleaner for the people who thought you were dead. Ivory looked at her. Something moved in the space between them. Classification. She said it was only quiet. The weight of something He came in with 2 aides and no announcement, and the effect his entrance produced was not manufactured. It was the involuntary response of a room full of people confronting rank earned in places and conditions that the insignia on a uniform could only approximate. The rows of decorations on his chest were not ceremonial. They were a record, compressed into metal and ribbon, of decisions made in circumstances where decisions had weight. He moved through the bay without slowing, his eyes covering the stretchers, the staff, and the evidence of 2 hours of crisis management with the comprehensive read of someone accustomed to assessing complex situations in a single pass. He stopped when he reached Ivory. He looked at her, the full inventory. Scrub top with the trainee badge, 3-week-old shoes, hair pulled back without ceremony, the gloves removed and folded in her left hand, the edge of the blast scarring visible at her right forearm where the sleeve had ridden up. Her face. He came to attention. Full military attention. Not the abbreviated professional acknowledgement that senior officers offered in informal situations, but the specific postural statement that carries the entire weight of institutional recognition. The physical language of respect expressed through the body of someone who has the authority to grant it and is granting it completely. Staff Sergeant Ivory, he said, welcome back. The bay did not produce a sound. Cassian was against the far wall. He had not moved from that position since the phone call. He was watching the general salute a trainee nurse in his department, and the expression on his face was the expression of a man for whom several previously stable structural assumptions had just been simultaneously revised. Erica had not stood up from the chair she'd sat down in. She was looking at her hands in her lap with the expression of someone who has decided, wisely, that this is the moment for careful reflection rather than speech. Bradley had retreated to the doorway. He was standing with the posture of someone who would very much like to be somewhere else, but has the professional self-awareness to remain visible, present, and above all, quiet. Raymond's clipboard was on the floor. He had not picked it up. And the SEAL operators in the bay, the ones conscious enough to process what was happening, had done something that required no coordination and no command. One by one, beginning with Fletcher and then Ronan, and then the others capable of the movement, they straightened. Not dramatically, not performatively, with the quiet, particular dignity of people acknowledging something they recognized. Daisy watched it happen and felt the thing in her chest that had been building since the tourniquet adjustment 2 hours ago reach a pressure it could no longer contain. She did not attempt to stop the tears. She did not look away. Kingsley held the salute for a 3 count, long enough to be deliberate, short enough to be professional, then lowered his hand and turned slightly to take in the room. His gaze found Cassian. Colonel Cassian. His voice carried no particular heat. The absence of heat was, if anything, more effective than its presence would have been. I'll need your complete incident documentation for this evening. Every decision log, every personnel intervention record, every communication pertaining to non-standard protocol during the mass casualty response. He paused. My office, 0800. Yes, sir. Every document, not the version written for review, the actual record. A fractional pause. Yes, sir. Kingsley's gaze moved to Raymond, who was visibly calculating how quickly the night's administrative record could be organized. The personnel file access attempts, Kingsley said, all of them, logged with timestamps. His tone remained even, which was in some ways worse than if it had not. The classification on that file exists for reasons that will be explained to you in due course. What you need to understand now is that any further access attempts, without direct SOCOM authorization, will be processed under UCMJ. Is that understood? Yes, sir. Raymond bent and retrieved his clipboard. He did not appear to find this act as reassuring as he might have hoped. Kingsley turned back to Ivory and spoke at a volume calibrated for her and the 3 people immediately adjacent. The situation that brought you to this facility tonight, he said, was not random. Ivory looked at him steadily. No, sir. Your assignment here was a transitional placement, recovery and observation. The cover documentation was intended to remain intact until you were ready for operational return. A pause. The timing of tonight's mass casualty event was not anticipated. No, sir. But the outcome was manageable. Something crossed Kingsley's face that might, in a different man, have been a smile. 12 out of 12 in a 2-hour window with restricted authorization. He glanced toward Ronan, then back to Ivory. Manageable is one word for it. Fletcher spoke from his stretcher without raising his hand. Sir, permission to ask a question. Kingsley looked at him. Petty Officer Fletcher, Team 9. Fletcher's voice was carefully controlled, which made the thing underneath it more visible, not less. What we were told in the after-action, that all primary team members were unaccounted for. He paused. Ivory was the only one listed as MIA rather than KIA. That's correct? The other 2. The question was not a question. It was the particular verbal form of a hope that has been waiting long enough to be afraid of its own answer, and has decided the answer is survivable regardless. Kingsley was quiet for a moment, not the quiet of someone deciding what to say, but the quiet of someone deciding how much the moment could hold. That, he said, is part of what I need to speak with Staff Sergeant Ivory about privately. He looked at Ivory. When you're finished here, Ivory's response was barely a movement, a slight change in the quality of her stillness that contained, if you knew how to read it, approximately 4 years of waiting in condensed form. I'm finished now, sir. No, you're not. His voice was firm but not unkind. You have 11 other patients, a documentation backlog, and a department that needs you to finish what you started tonight. A pause. 20 minutes. Ivory looked at the 12 stretchers. Then she turned and went back to work. Every doctor in that room just watched a trainee nurse do what none of them could. They called it luck. They called it coincidence. They called it anything except what it actually was. Subscribe now and share this video, because the truth about Ivory is already changing everything in that room, and the final piece hasn't landed yet. What followed was not the absence of tension, but its transformation, the shift from crisis to the particular focused efficiency that follows crisis when the people involved are competent and understand what needs to happen next. Ivory moved through the bay with the same economy she'd brought to everything since the night began, but with an authority the room no longer questioned. And in that authority's presence, something else happened. The people around her became better at their jobs. It was not obvious. It did not announce itself. But Daisy, observing Ivory, assessed the remaining patients with the comprehensive attention of someone for whom triage was not a checklist but a fluency, began to adjust her own monitoring approach, calibrating toward the more careful standard she was witnessing. Hugo, working through the anesthetic tapering on stabilized patients, found himself applying a degree of precision to his pressure readings he typically reserved for complex cases. Even Floyd, at his station across the bay, was working with a slightly different quality of attention, the specific alertness of a technician who has been reminded by proximity to genuine mastery that their own standards can be higher. Heather watched all of this from the bay entrance with the expression of a woman who had suspected something for 3 weeks and was now watching the confirmation of that suspicion play out in real time. She had not been wrong. She was rarely wrong about people. It was the primary reason she had stayed in her role for 31 years, when nearly everyone who had started alongside her had moved on to administration or to quieter pathways. She had stayed because of nights like this, because of the people that nights like this revealed. At exactly 20 minutes, not 19, not 21, Ivory removed her gloves for the final time in the bay, handed the updated chart for Stretcher 7 to Daisy, with 2 brief verbal notes, and walked to the bay entrance where Kingsley was waiting. They moved to the consultation room at the end of the corridor, a narrow space with a folding table and 4 chairs, used primarily for family notifications. One aide positioned himself outside the door. Kingsley sat across from Ivory without preamble. 2 names, he said, Callahan and Park. Both were assessed as KIA at the Sector 7 extraction point. Ivory did not speak. New intelligence intercepted communications 2 weeks ago. Signal analysis from a location in Sector 4. He paused. The communication contained operational code phrases exclusive to Team 9's classified mission parameters. Phrases that should not be in circulation. The silence in the consultation room was very different from the silence in the bay. In the bay, silence had been something the crisis produced and the resolution interrupted. This silence was the specific quiet of a person absorbing information that had rearranged several years of their understanding in a single sentence. KIA confirmation, Ivory said. Her voice was steady in the particular way that requires effort to achieve. There was confirmation. Recovery team assessment under fire, 45 minutes post-extraction, in conditions not conducive to thorough... Kingsley stopped. He said what needed to be said directly. The confirmation was not what it should have been. The team was taking fire. The report was filed based on available evidence under extreme circumstances. He held her gaze. The available evidence was incomplete. Ivory was quiet for a long moment. You're telling me they may be alive. I'm telling you the signal's intelligence suggests someone with operational knowledge of Team 9's mission parameters is at a location in Sector 4. What that means requires verification. And verification requires someone with specific knowledge of the team's communication protocols, procedural signatures, and the operational details of the August 12th mission. He held her gaze. Someone who was there. Timeline, Ivory said. 72 hours to maintain signal integrity on the intercept location. After that, the source relocates and we lose the thread. Kingsley placed a single sheet on the table between them. Sector 4 coordinates, intercept summary, authorization codes for your operational reinstatement. He paused. It's voluntary. Your medical and psychological clearance is current, but the assignment parameters, when do I leave? He studied her face, not looking for doubt, which he had already assessed was absent, but for the specific distinction between someone who was ready because they had processed what needed to be processed and someone who was ready because movement felt better than stillness. What he found was the former. 2,200 hours tomorrow gives you time to rest and... I'll be ready. A moment. Finish your shift. Get some sleep. He stood. And Staff Sergeant, he paused at the door. The work tonight. He did not elaborate. He did not need to. Good work. He left. Ivory sat in the consultation room for 1 minute and 40 seconds. She sat with her hands on the table and her back straight, and her eyes on the middle distance, on nothing specific, but on the general space where the thing she had been carrying lived, and where it had just been joined by something new that was heavier in a different way. Then she stood and went back to the bay. The bay had shifted in her absence. Not physically. The stretchers were in the same positions. The monitors showed the same patients. But the quality of the room had changed in the specific way rooms change when something has been collectively witnessed and resolved. The particular pressure of unfinished crisis was gone. What remained was the work. The specific human enterprise of 12 people being helped to stay alive by other people who had decided this was the thing worth doing tonight. Erica was on her feet again. She had not, in the time since she'd sat down, found a way back to the version of herself that had occupied this bay 2 hours ago. That version was not available for retrieval. What was available was a more honest version, less comfortable, more useful, and she was working in it with the slightly careful quality of someone navigating new terrain. When Ivory returned to the bay entrance, Erica looked at her. The look held for a moment. Then, "Patient 11, surgical airway is holding, but the positioning isn't optimal. Can you check it?" Not a question with an agenda, a clinical question from someone who needed an answer. "Yes," Ivory said, and crossed to stretcher 11. It was the smallest possible form of the thing that needed to happen. No speech, no formal acknowledgement, just a question asked in good faith and answered in kind, both people understanding, without requiring it to be stated, that this was the territory they were operating in now. Daisy watched from the supply cart. She had stopped crying. She was doing the thing she did when she was thinking, organizing items by category without consciously directing the process, which freed her mind to work on something else. She had been thinking about the word Ronan had said, ghost. She had been thinking about the way Ivory had gone still when she heard it, and the way Fletcher had gone still when he saw Ivory go still, and the way all of that stillness had communicated something the room had been unable to name until Kingsley walked through the door and named it by implication. She was thinking about the fact that Ivory had been here for 3 weeks, that she had come to work every day in the same scrub top with the same trainee badge, and had done the tasks she was assigned, and had not, in 3 weeks, given anyone a reason to look at her differently than the thing the badge said she was, that she had stood in this bay tonight and watched 12 men be triaged and had been pushed out and dismissed and challenged and threatened, and through all of it had done exactly what needed to be done, no more, no less, with a precision and patience that Daisy was only now, in retrospect, able to recognize as something more than competence. She had been invisible on purpose, and she had stopped being invisible only when the alternative was a patient dying. At the supply station near the corridor junction, Daisy's hands were not quite steady as she sorted. It was not fear. It was something closer to the feeling of standing near something very large and finally understanding its full dimensions. Floyd had been working in the far section of the bay since his conversation with Ivory, quietly, efficiently, without the territorial energy that had characterized his movements earlier in the night. When he came near the monitoring station where Ivory was updating the chart for Stretcher 5, he stopped. "There's something I want to say," he started. "You already said it. I know, but I want to add to it." He squared himself to the conversation rather than to the chart. "I've been in emergency medicine for 14 years. I've trained alongside some of the best trauma surgeons in this system." A pause. "What you did tonight with the hepatic assessment, blind without imaging under pressure, that's not something you see in a hospital. That's something you develop in environments that most people in this building will never be asked to enter." He stopped. "I didn't hear the argument because I wasn't listening for it from someone in your position. That's a bias I intend to correct." Ivory put down her pen. She looked at him directly. "The bias is the problem more than the individual decision," she said. "The decision can be fixed in the moment. The bias has to be fixed before the moment arrives." Floyd absorbed this with the expression of a man who has received a correction he knows is accurate and has decided to do something about it. "Yes," he said. "That's exactly right." He returned to his station. Hugo, clearing the last of the Reboa procedural materials, found himself standing beside Ivory at the monitoring station with the openness of someone whose professional armor had been temporarily removed by a very long night. "Kandahar," he said quietly, "the redacted name in the after-action summary. I spent the first hour tonight trying to figure out who you were." He looked at the monitor showing Ronan's stable numbers. "I should have spent that hour listening to what you were saying instead." "You listened when it counted," Ivory said. "Ronan's alive. That's the measure." "Is it always that clean for you, the accounting?" A pause that was not quite hesitation. "No, it's never clean." She adjusted a setting on the monitoring display. "But a life saved is something you can build on. A life lost because someone was too proud to hear an argument. That one you carry differently." Hugo was quiet. "How many have you carried?" Ivory looked at the bay. 12 monitors. 12 steady numbers. "Fewer than I might have if the people around me had been worse at their jobs." She turned from the display. "Tonight, that number didn't go up. That's what I'll take from it." She moved on to Stretcher 9. The administration of consequences in a military hospital has a rhythm to it, slower and more procedural than the clinical work, but no less consequential for those involved. Raymond, having retrieved his clipboard and his professional composure in roughly equal measure, was in the corridor completing the incident documentation with the careful attention of someone who understood that every line he wrote was going to be read by people with considerably more authority and considerably less patience than he normally operated around. He had made, in the last hour, several quiet revisions to his approach. The most significant of these was the decision to document everything he had observed accurately and in sequence, which was not always the default in situations where accuracy reflected poorly on decisions already made. He did this not because he had been asked to, but because Kingsley's voice when he said the actual record had communicated something that Raymond's professional instincts recognized as the kind of instruction that rewarded strict compliance. Bradley remained in the bay until the shift began to wind down, occupying a position near the entrance that was close enough to be available and far enough from Ivory to be unmistakably deliberate. When Ivory passed near him on her way to the documentation station, he spoke without looking directly at her. The specific posture of someone acknowledging a social debt without being certain of the correct form for it. "Staff Sergeant," his voice was low. "Earlier tonight, when I moved to—" He stopped. "I was following orders under incomplete information." "You were doing your job," Ivory said. She kept walking. "So was everyone else." She said it without the weight of a verdict. The lightness of it, the complete absence of blame in the statement, was, if anything, more disorienting to Bradley than anger would have been. He stood at the bay entrance for a long moment after she passed, working something through that was going to take longer than the remainder of a night shift to fully process. The shift documentation was completed at 03:12. Ivory carried the last of it to the administration station near the bay entrance, where Heather was finishing the night's requisition records, with the steady efficiency of someone who did not need to rush because they had always done the work correctly the first time. Heather looked up when Ivory placed the charts on the desk. "You'll want to file the SCI incident notification before you leave," she said. "Raymond won't. He's been very carefully not touching anything involving your paperwork since Kingsley left." Ivory sat down at the adjacent terminal. "I'll do it now." Heather watched her for a moment. Then she opened the small drawer on the right side of the station and produced an envelope. Plain white, unmarked except for a name on the front, Ivory's name, written in a handwriting that was not Heather's. "This was in the duty officer transfer packet when I came on shift 3 weeks ago," Heather said. "I was told to hold it until the appropriate moment." She placed it on the desk between them. "I've been making a judgment call about the appropriate moment every day since then." Ivory looked at the envelope. She looked at her own name in the unfamiliar handwriting. She did not pick it up. "Who left it?" The transfer documentation listed the source as SOCOM Administrative Liaison. Heather paused. "The handwriting is not administrative." Ivory's jaw tightened fractionally. She picked up the envelope. The seal had been carefully maintained, intact, the specific deliberateness of someone who understood that the content was for one person and had taken care to ensure it reached them that way. Ivory broke it cleanly, removed the single sheet inside, and read it. She read it once quickly and then again slowly. On the second pass, something changed in the quality of her stillness. Not distress, not relief, but the specific recalibration of someone who has been carrying a particular understanding for 3 years and has just been given information that revises it in a significant direction. She folded the paper, put it in her pocket. "Good news?" Heather asked. "Complicated news," Ivory said. "The best kind." She finished the incident notification, logged out of the terminal, and stood. The bay behind her was quieter now. The particular settled quality of the last hours before dawn, when the crisis has resolved and the patients are sleeping and the equipment is doing the steady monitoring work that equipment does well and humans cannot do continuously. She picked up her jacket from the hook near the bay entrance. The civilian jacket she'd arrived in, plain and dark and unremarkable. She put it on over the scrub top and the trainee badge disappeared beneath the lapel. Heather watched her. "Will you be back?" Ivory buttoned the jacket. "Not as a trainee nurse." "No," Heather said. "I didn't think so." A pause. "Whatever comes next, be careful with it. People keep telling me that. People who say it usually mean it." Ivory looked at her for a moment. The full, complete look she'd given to Hugo, to Fletcher, to Daisy. The look of someone who does not give her attention carelessly and is giving it now as the specific thing it is, acknowledgement of a debt sincerely held. "You knew," Ivory said. "I suspected. From around day 4. What gave it away?" Heather considered. "The way you sit in an empty room," she said finally. Military people sit differently when they think no one is watching. The training goes that deep. A pause. Also, you alphabetize the supply inventory by class and subclass rather than by common name. That's a military pharmacological habit. Civilians never do that. Ivory held her gaze for a beat. I'll have to work on that. Yes, you will. Something softened briefly in Heather's professional demeanor. The acknowledgement that a wall between two people has been declared unnecessary by mutual agreement. Good luck, Staff Sergeant. Thank you, ma'am. Ivory turned and walked toward the bay exit. At Stretcher 7, Ronan was awake. He had been awake for most of the last hour, running the careful inventory of a person assessing the state of their own continued existence with professional thoroughness. He watched Ivory approach and held her gaze with the directness of someone who has a finite amount of energy and has decided not to spend any of it on indirection. I'm going to ask once, he said, and I need a straight answer. Ask. Are you going back in? Ivory stood at the foot of his stretcher. The challenge coin was already in her jacket pocket. She had put it there without thinking, the same unconscious motion that Fletcher had been performing for 3 years. Yes, Sector 4. Not a question. He'd heard enough in the bay to know. Possibly. The lines around his eyes deepened. You need backup. Not yet. Ghost? When I need backup, she said, and her voice was steady and specific and carried the full weight of everything the night had been. You'll be the first call I make. You and Fletcher both. She adjusted the blanket at the foot of his stretcher without being asked. The small, precise motion of someone who notices the practical thing and does it. Right now, you need to let the procedure do what it's doing and stop trying to sit up. He looked at her for a long moment. 3 years of wait and relief and the particular complex arithmetic of people who have survived something together and have to figure out what that means for what comes next. You're still the only person who ever made me feel bad about being injured, he said. It's a skill. She stepped back from the stretcher. 72 hours. I'll be in touch. She went to the door. At the recovery area, she stopped by Fletcher. He was upright, shoulder bandaged properly, the wound in his arm immobilized with the precise wrapping Ivory had applied herself at some point during the last 40 minutes without announcement. He was holding the challenge coin, his copy, the one he'd kept. He extended his hand, the coin in his open palm. Ivory looked at it. She looked at him. The exchange between them in that moment was the kind that does not require language, because the language that would do it justice does not exist in the form of words. It exists in the specific quality of recognition between people who have been through the same thing and have been changed by it in ways that are identical in nature, if not in detail. She took the coin. She held it for a moment, her thumb moving across the worn edge in the same pattern Fletcher's had, the tactile memory of an object reclaiming its owner. Then she closed her fingers around it and looked at him with the expression of someone who has just been handed back a part of themselves they had stopped expecting to recover. The other two, Fletcher said, quietly. Just the 3 words. There may be information, Ivory said. Equally quiet, equally precise. Fletcher received this the way a person receives information when they have been preparing themselves for one answer and have been given a different one, not with immediate relief, because the instinct of someone who has been in the field is to hold hope at a slight distance until it has been tested, but with the recognition that the distance had just become considerably smaller. When do you know? 72 hours. He looked at her for a long moment. Then he nodded, the nod of someone who has asked the question they needed to ask and received the answer that allows them to go back to waiting. Be careful, Ghost. I'm always careful. That's not what the Kandahar after-action report says. Something moved across Ivory's face, not quite a smile, but the ghost of one. The Kandahar report was missing several contextual factors. They always are. She left him there, holding the coin, and went back into the bay for the last time. Ethan, the night cycle nurse who had arrived for the rotation handover and had spent 20 minutes absorbing the atmosphere of the bay with the wide-eyed attentiveness of someone arriving at the final act of something significant, found a moment to approach Ivory while she completed the last intake charts. He was 23, earnest in the way that people are earnest before the work has processed them into something more durable. What you did tonight, he said, with the triage assessments, the guidance, is there a path to learning that? Not in a classroom, I mean the real version of it. Ivory capped her pen. She turned to look at him with the fullness of her attention, the kind she had given to the vital signs monitoring 2 hours ago, to the Reboa guidance. This young man in front of her was not in crisis, but he was asking something that deserved a real answer. "Pay attention to the patient before you pay attention to the machines," she said. "The equipment tells you what already happened. The patient tells you what's happening now, if you know how to listen." She paused. "And don't let anyone turn you away from a patient you're not sure about. If you're uncertain, that uncertainty is data. Use it." She picked up her pen again. "The path is just that. Every day, every patient. No shortcuts." Ethan looked at her with the expression of someone who has just been told something they intend to keep. "Yes, ma'am. Get to work," she said, not unkindly. The way people who have done hard work for a long time say it to people who are about to begin. Cassian approached near the end of the shift, carrying nothing, standing at the correct professional distance, and speaking without the cadence he had been using earlier in the night. "I don't have a frame for this that doesn't sound inadequate," he said, "so I'll say it directly. The decisions I made tonight regarding your role, the restrictions, the removal from patient contact, those decisions were based on available information and standard protocol." He paused. "They were also wrong, not procedurally, clinically, and clinically is the category that matters in a room with 12 casualties." Ivory looked at him. No accumulated weight of the night's dismissals, just a direct look, even, without warmth or coldness. "The protocols exist for reasons. That's not the problem. What is the problem? They were applied before the available information was complete. Next time someone in this bay tells you something that contradicts your current plan, hear the argument before you hear the credentials. The argument comes first." Cassian absorbed this with the expression of a man receiving a correction he did not intend to dispute. "Yes," he said, simply, without qualification. He went back to his station. Ivory watched him go with the expression of someone marking a thing that has been resolved, not as victory, but as a change in the terrain that both people are now going to have to navigate differently. It was, in the end, the best possible outcome for a night that had started with a dismissal and a man's life at stake. Not transformation, not apology sufficient to the scale of what had happened. Just a correction, sincerely made, and a door opened onto better judgment the next time. In a crisis environment, that was what progress looked like. Small, specific, pointing forward. She went to complete her final documentation. Outside, the receiving bay was empty. The transport vehicles were gone. The asphalt was wet from a brief rain, while the bay had been consuming all available attention, and the reflection of the facility's lights lay across the surface in long, wavering lines. The air had the particular quality of the hours before dawn. Not yet morning, not quite night, the specific atmosphere of the transitional time that belongs to people who are between one thing and the next. Ivory walked to the far edge of the receiving area, where the light from the facility reached its boundary, and the darkness of the base's outer perimeter began. She stopped there. She took the envelope from her pocket and removed the letter again. The handwriting was Callahan's. She had known it immediately. She would have known it in any condition, under any circumstances, in any light. 3 years had not altered the specific character of a script she had spent months reading in field notes and mission parameters, and the marginal comments of someone who had thought better in pen than in speech. The letter was dated 6 weeks ago. It was short. It said what it needed to say in the spare, precise language of someone who had been trained to communicate essential information without waste. It said that the communication protocols they had established before the mission were still being used. It said that the location in Sector 4 was not accidental. It said that the 72-hour window was real, and that the package, the word they had used for the specific combination of verification codes and extraction coordinates, was in place. The last line read, "We knew you'd find us when you were ready. Take your time. We're not going anywhere." The humor in it, the specific, understated, entirely characteristic humor of someone choosing those words from a position of considerable precarity, was so perfectly preserved across 3 years of separation, and everything that had happened in them, that Ivory stood with the letter in her hand and felt something move through her that was not grief, and was not relief, and was not joy, but contained all three in the compressed form of something that has been waiting a long time to be released. She stood with it for a full minute. She let it be what it was. Then she folded the letter with the same care it had been folded with when it arrived, placed it in her jacket pocket beside the challenge coin, and looked up at the sky over Camp Lejeune, which was showing, in the east, the first fractional lightning that announced dawn's approach without yet committing to it. Behind her, through the walls of the facility, 12 monitors continued their steady recording. 12 men breathed through the remainder of the night toward the morning. In Bay 4, Daisy was finishing her handover documentation with a quality of attention that was slightly altered from what she'd brought to the beginning of the shift. More deliberate, more specific, more attuned to the difference between what the machine said and what the patient said. In the consultation room, Cassian was writing a report that was going to require several significant revisions to his understanding of things he had previously considered settled. Heather was completing the last of the night's records with the steady pace of someone who had done the work correctly the first time and did not need to go back. Fletcher, in the recovery area, had finally closed his eyes. His challenge coin, his copy, the one he'd kept, was still in his left hand. In the recovery area, half asleep in the specific way of a man whose body had decided it had done enough, Ronan said something to Fletcher too low to carry far. Fletcher, not quite asleep either, responded without opening his eyes. What Ronan said was, "She's going back in." What Fletcher said, his voice rough with exhaustion, and something that was not exhaustion, the coin still pressed in his closed hand, "She never really left." Ivory turned away from the facility entrance and walked across the empty receiving bay toward the base's perimeter road. Her footsteps were even on the wet asphalt. The jacket covered the trainee badge. The challenge coin in her pocket was the weight of something real. The letter in her other pocket was the weight of something possible. 72 hours, 2 names. A location in Sector 4 that someone had gone to considerable trouble to make findable by exactly one person. She had made the calculation the way she made all calculations. Quickly, completely, without sentimentality but not without feeling, arriving at a conclusion she was prepared to act on without requiring the kind of certainty that the world rarely offered. She had learned in the years between Kandahar and this wet asphalt and this particular shade of not yet morning that certainty was a luxury of peacetime. In the field, in the bay, in the corridor, the decision was always made on incomplete information, with what was available, in the direction the evidence pointed. The evidence pointed toward Sector 4. The evidence pointed toward 2 names that had been listed as closed and were, it was beginning to appear, very much open. The evidence pointed forward. She walked. The east continued to lighten. That specific blue-gray that arrives before any warmth, before any color, the color of the world deciding whether to commit to another day. It was the color Ivory had seen from field positions in the minutes before 0600. It was the color of the sky over Kandahar on August 12th. It was the color of every morning that had come after that one, including this one, which was coming now whether or not anyone was ready for it. Behind her, the facility ran its quiet, vital work of keeping people alive. Ahead, the perimeter road stretched north into the remainder of the night. She had 12 patients who were going to see this morning because of the decisions made in the last 2 hours. She had one room of people who were going to move through their next shift differently than they had moved through this one. She had a general who had used the words, "welcome back," and meant them in every dimension they carried. She had a letter in her pocket in a handwriting she would recognize anywhere, written by someone who had waited 3 years and was still waiting, and who had ended a message sent across that impossible interval with something that was either a joke or a statement of absolute faith, or most likely both. "We're not going anywhere." The road turned north. Ivory's figure grew smaller against the lightening sky, and then disappeared around the bend, into the interval between one thing and the next, carrying what she carried. The coin, the letter, the 12, the 2, the work still ahead, with the same economy and the same steadiness with which she had carried everything else. The morning came. Service doesn't announce itself. It simply does what the moment requires, for as long as the moment requires it, and trusts that the work, in the end, is enough. If this story hit you somewhere real, share it with someone who needs to hear it today. Subscribe for more stories of the overlooked, the underestimated, and the ones who never needed anyone's permission to be extraordinary.